Even in small amounts, alcohol has an immediate effect on our bodies. Consumed alcohol is rapidly absorbed through the blood vessels and spreads throughout the entire body. However, contrary to what one might think, the amount excreted through urine or breath is extremely small. Drinking with fatty foods slows down the absorption rate, but if you drink more than your body can process, you will eventually get drunk. The rate of alcohol processing varies depending on various factors, such as an individual's body size and gender. A point particularly worth noting here is that women absorb alcohol better than men and have longer processing times, making them more vulnerable. Alcohol causes physical and emotional changes even in the short term. This is by no means a problem to be taken lightly. Long-term drinking acts as a serious risk factor for health and exerts a wide range of negative effects on the body that can even be life-threatening. The excretory system of our body plays a crucial role in processing and removing waste like alcohol. In this process, the pancreas secretes digestive enzymes to help digest food and performs key functions in regulating insulin and glucose levels. However, excessive alcohol consumption causes the pancreas to produce toxic substances, hindering its normal function. The resulting inflammation is pancreatitis, which is a serious disease that can permanently damage the pancreas or, in severe cases, be life-threatening. Alcohol abuse is cited as one of the primary causes of developing chronic pancreatitis. Next is the liver, our body's detoxification factory. The liver breaks down harmful substances, including alcohol. However, excessive drinking causes alcoholic liver disease, which can lead to jaundice. Chronic inflammation in the liver creates severe scar tissue in the liver called cirrhosis, destroying liver function. If the liver cannot function properly, toxic substances accumulate in the body, and liver disease can lead to life-threatening situations. As mentioned earlier, there are research results showing that women are more vulnerable to alcoholic liver disease than men. If the pancreas and liver fail to function properly, the risk of developing hypoglycemia increases. In particular, if the pancreas is damaged, a lack of insulin prevents the body from properly using sugar, which can lead to hypoglycemia. Instability in blood sugar levels is dangerous and is especially fatal for diabetic patients. Additionally, alcohol abuse can increase the risk of developing liver cancer. One of the first changes that appear due to alcohol consumption is a change in behavior. Alcohol moves quickly through the blood to the brain and central nervous system. Because of this, people who drink a lot develop slurred speech and impaired coordination, leading to staggering and an inability to walk properly. They also experience difficulty thinking clearly, and their impulse control and memory are negatively affected. Long-term drinking shrinks the frontal lobe of the brain, and sudden alcohol withdrawal can cause seizures and delirium. Severe alcoholism can progress to permanent brain damage and become a cause of dementia. Damage to the nervous system can lead to pain, numbness, and abnormal sensations in the hands and feet. Alcoholism causes a deficiency in thiamine, which is vitamin B1, and this can lead to unintended eye movements and paralysis of the eye muscles. Men and women metabolize alcohol differently. Generally, women are more affected even by smaller amounts. Over time, heavy drinkers become more physically and emotionally dependent on alcohol and are likely to lose control. Unlike most addictions, sudden alcohol withdrawal can be life-threatening. In cases of severe chronic alcoholism, medical detoxification is essential. When an alcoholic suddenly stops drinking, they may experience withdrawal symptoms such as nausea, anxiety, nervousness, and tremors. In severe cases, confusion, hallucinations, and seizures may occur. This detoxification process takes about 2 to 7 days.